And welcome to the Dr. Bob Show. We'll be spending most of this show talking about your blood glucose or your blood sugar. Is there a difference between glucose and blood sugar? And what happens if your blood sugar goes out of whack? What if it gets too high? What are the problems? It can be pretty severe. It could be blindness, heart attacks, stroke, amputation, no blood supply to the extremities. Pretty serious. My guest is Dr. Bill Law, board-certified endocrinologist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about what tests should you and your doctor make sure you have done to stay healthy, stay alive, and stay disease-free. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Bill Law, board-certified endocrinologist. We'll be talking about glucose and blood sugar. Bill, welcome to the Dr. Bob Show.
Thank you, Bob.
What is the difference between blood glucose, blood sugar? What are they and what's important?
They're exactly the same terms. It's like potato. Sugar equals glucose.
So fasting blood sugar is like fasting blood glucose level.
Correct.
So that's the blood sugar. What does sugar do in the blood?
Well, it doesn't do a whole lot in the blood. It's when it gets out of the blood into cells that it causes the problem. But the body must have some sugar. There are certain tissues that only use sugar for their energy source. And so it's like the three bears in the porridge. It needs to be not too high, not too low, just right. And that's where the challenge comes in.
And the blood sugar, if you can get it into the cells, that's where the energy is sort of made? If it's swimming around the bloodstream, doesn't do anything?
Nope, it's got to get into the cell.
So how does it get into the cell, basically?
Well, insulin is a critical component of this. Insulin acts like a key that has to combine with a lock on the cell surface called a receptor. And when that combination occurs, it opens up little doors in the cell membrane and lets the sugar get out of the bloodstream inside the cell, where the cell can then do whatever it's going to do with it.
If that key won't unlock the cell, then the blood sugar stays in the blood.
Builds up just like water behind a dam.
Now, when that water gets too high, if that blood sugar gets too high, if that blood glucose gets too high, what are symptoms that people have?
Well, the problem is it's got to be really high before patients get symptoms just from that, because the kidney can reabsorb sugar even if it gets up to like 150 or 175 even. It can reabsorb it all back into the bloodstream. So it's only if the sugar gets really high, up in the 200, 250 or high, where you just overwhelm the poor kidney. It can't reabsorb all that sugar that's in the blood that's being pumped through it all day. And so then it spills over in the urine. Well, when it spills over in the urine, of course, it's a crystal, like sugar in a bowl. It's got to have fluid to dissolve it. Well, so you suck extra fluid out of your body. You may find that you're thirsty all the time and having to get up in the middle of the night 2 or 3 times to go empty your bladder. Your lens in the eye, it swells up like a big sponge that's put in water, you know, and then that changes the way the light rays are bent when the light rays pass into the back of the eyeball, and you get real fuzzy vision. You can have all kinds of effects if it gets really high, but if it's just mildly elevated, patients may not feel indifferent at all, and that's the danger.
What's the normal value of blood sugar, fasting blood sugar in the morning?
You would like to see the blood sugar be less than 105.
Less than 105. Now, what is the level that it takes to make the diagnosis, you've got diabetes?
Well, there are multiple ways of confirming the diagnosis of diabetes based on American Diabetes Association endorsed criteria. One of them, of course, is on the glucose tolerance test, but we hardly ever need to use that now. Second is on the absolute blood sugar level. If you have a reproducible blood sugar level of fasting blood sugar of over 125, that's considered diagnosis of diabetes, presuming that you're not sick or something.
Sure.
And then frankly, the easiest way is to measure what's called the hemoglobin A1C, which is a simple blood test.
What is
and
that?
if it's over 6.5.
6.5 is the number for A1C. Now, hemoglobin A1C, why is that better than a fasting blood sugar? You want it 103, but you don't want it over 125. That's the diagnosis. What is the A1C? Why is that better than this?
Well, one, it's a lot more reliable because the A1C test gives you a number that's proportional to the average blood sugar, integrating all the ups and downs when you eat, fast, exercise, etc., over 3 months. So it really is a very well representative number of what's been going on over time in your body, as opposed to just one single point in time blood sugar.
So A1C 6.5, it's greater than 615, that's bad?
Yeah.
And less than 615 means you're in a good level most likely.
Well, less than 6 is absolutely normal. 6 to 6.5 is sort of like being a little bit pregnant. Then over 6.5, you definitely got it.
Now, what predisposes somebody to have an elevated blood sugar? Are there certain things that happen that make people have a high blood sugar?
Absolutely. A major contributing factor is your genes. The apples don't fall too far from the tree, as they say. If your mama and your daddy had diabetes, you've got a definitely increased risk of diabetes.
And so that's why it's important to ask in that family history.
Correct.
So genetics.
And then another major component is your weight. For the same genetics, gaining weight, everything goes up. If you gain weight, your blood sugar drifts up, your blood cholesterol builds up, your blood pressure builds up. Everything gets worse when you gain weight. And more importantly, it all gets better if you get the weight down.
Tell me about insulin. What is insulin? What does it do to the sugar and to diabetes?
Insulin is a hormone that comes from the pancreas gland, which is back in the very back part of the stomach or the abdomen behind the stomach. And it's that key that opens that lock. You have to have insulin to open that lock, but that lock has to be receptive to insulin. It has to be sensitive to the insulin. And so you can have plenty of insulin, but it just doesn't work well.
Briefly, if somebody's blood sugar goes too high, if you establish the diagnosis of diabetes, what are some of the problems that people can get? You said the eyeballs or the inside of the eye can swell there and you get fuzzy vision. Can you get blindness?
Yeah, but the blindness is related to abnormal blood vessels and hemorrhage in the back of the eye, whereas the fuzzy vision, that can come and go based on what the sugar level is, because that's in the lens of the eye, which is in front of there, that just, like a lens on a camera, it changes how the light rays are bent. But that can go away just by getting the sugar better controlled. If you have a big hemorrhage back here, you may lose vision permanently. Diabetes is the leading cause of blindness in this country.
So that blood sugar is very important. Are there other things that a high blood sugar can do, other organs in the body that can be involved?
It's sort of like pickles. If you put nice fresh cucumbers in enough brine, they kind of decompose and turn into pickles. Well, same thing, high sugar pickles your body tissues.
And that's what we're going to be talking about when we come back. How does brine and pickles cause damage to the rest of the body? It's a good analogy, and we're going to want to stay tuned. First, let's look at a patient that was overweight. Let's see what happened to their blood sugar and what happened when they lost the weight. We're talking with Jerry McDaniel. And Jerry, you've got a great story. About 3 years ago, what was your weight?
About 3 years ago, I was 300 pounds.
300 pounds, and you had diabetes, and you were trying to get that weight down by doing what?
Exercising.
How much?
I was exercising all the time.
Was that helping you lose weight? Was it helping your blood sugar?
It would take a little bit of weight off, but not like I wanted it to come off.
And eventually you lost some weight and then your weight came back. Is that right?
That's correct.
When your weight came back, what did your blood sugar do? What did your diabetes do?
My blood sugar went through the roof. I had I was anywhere from 300 to the 500 range.
Wow. Did you feel poorly?
I felt bad.
Was your blood pressure up?
My blood pressure was up.
Through a group of questions, you got to see Dr. Bill Law, and Dr.
Correct.
Bill Law said you were going to have to lose weight. Is that right?
That's correct.
And you went on a diet?
I went on a diet.
Tell me what the results have been.
I started my diet just before Thanksgiving. I've lost about 53 pounds.
53 pounds in 5 months. That's great.
53 pounds.
How have you done that? Just eating good foods?
Eating whole foods, not box foods or pastas or anything with starches in them, and no soft drinks, just good food. Wholesome
And
food.
exercise?
And a little bit of exercise.
And your weight's come down. What's happened to your blood pressure?
My blood pressure's come down to normal.
To normal?
To normal.
And what's your blood sugar done?
My blood sugar now, instead of when I wake up in the morning being 254 to 300, it's now 105 to maybe 118.
I think that's fantastic. How do you feel?
I feel pretty well. I have more energy than I did before.
Now you sell Chevrolets. Are you selling more Chevrolets since your blood sugar's been better?
We are selling more Chevrolet since my blood sugar has been better.
We'll give Dr. Law the credit for that. Are you glad you found Dr. Law and that your blood sugar's better?
I am very, very happy to find Dr. Law, and he's done a terrific job on myself, and my blood sugar will prove it.
Yeah, I wish you the best of luck. I think that's a great story. You know, if people lose weight, their demands for insulin goes down and their blood sugar returns to normal frequently, just like yours did. Congratulations. That's a superhero story.
I appreciate it very much. Thank you, Dr. Bob.
We're talking with Dr. Bill Law, board-certified endocrinologist. And let me summarize a little bit. Glucose and sugar in the blood are the same thing. Fasting blood sugar, fasting glucose, the same thing. The glucose is needed to go into a cell for the cell to have energy. There is a key that lets the sugar into the cell. That's insulin. If the key is not working, the sugar doesn't get in, it goes too high, we can start getting damage in the eyes, and we can get damage elsewhere, and that's where we're going to go right now. Bill, what else? We talked about the eyes, hemorrhage in the back of the eye and the retina. Where else does blood sugar cause problems? What other part of the body, the brine and the pickle?
Well, all that high sugar in the blood is being pumped through the kidneys. Kidneys filter about 100 quarts of blood a day. That's a lot of sugar. Well, you kill off the kidneys. Diabetes is the leading cause of kidney failure in this country. You get kidney failure, go on dialysis, your life expectancy is markedly shortened. It pickles nerves, all the nerves in the body, where you get to where you can't tell where your finger is in space. You know, we've got little sensors in our body that allow us to close our eyes and put the finger on the tip of the nose, because I know my brain gets this input. You kill those sensors and you can just stumble all over the place and fall and break your leg or crack your skull. You may not be able to tell pain. You might step on something, a nail, for instance, you don't feel it. Or you might burn yourself. You know, pain, we think of pain being bad. Pain is protective. You put your hand on a hot stove, whew, you pull it away. If you've killed those sensory nerves, you're medium rare before you know it. It's scary. It can clog up the blood vessels going to the brain, to the heart. So much higher incidence of strokes and heart attacks, and block vessels to the legs, leading cause of amputation, diabetes. So every tissue in the body is harmed by prolonged high blood sugar. That's why it's so critical to not just treat based on how you feel, but to treat based on the science, because you can check your sugar very accurately. In 5 seconds, you can tell what your sugar is with a little finger stick.
So if the sugar is too high and it does all of this, what is the treatment for this high blood sugar, high glucose diabetes, greater than 125 fasting, hemoglobin A1C greater than 6.5? What is the treatment for that?
Well, there's a whole lot of very effective treatments available now, Bob. We've had an explosion in the last 15 or 20 years. It's just been amazing how many new rabbits we can pull out of the hat. The first line drug is one called metformin, which has been available in other countries for over 40 years. We've had it for about close to 20 years. And that's a first line drug. It's dirt cheap, it doesn't have any bad side effects, and most people can tolerate a pretty good dose effectively.
What does it do?
It makes that insulin work more effectively. It also tends to decrease the amount of sugar that the liver is adding into the circulation, because the liver is a factory. It's making sugar all the time. Sometimes people don't understand, well, if I don't eat, why is my sugar 250?
Why is that?
Because the liver is making sugar, and that manufacturing process has escaped.
So the liver stores it. What's it called when the liver stores? I mean, what is it in the liver that's
It's
stored?
called glycogen in the liver in the store, but we're talking about gluconeogenesis, new sugar molecule formation in the liver to add it to the blood.
So the liver stores the sugar, and if it lets too much sugar out, tell me what's going on there with as far as treatment goes. The metformin helps the sugar get into the cells. Can we keep the sugar from going into the liver with something? What's the other treatments?
Well, there's a lot of different ways that medicines work. As I said, there's a huge number of medicines available. Many of them work by decreasing the liver's rate of sugar molecule formation. They may actually stimulate the pancreas gland that makes insulin,
Put out
kind
a
of
little
goose
bit
it,
more?
make out a little more. Obviously, you can give insulin directly and raise the insulin levels in the blood, but the problem in patients with type 2 diabetes, as opposed to the typical type 1, the thin teenager, something with type 1 diabetes, because remember, the type 1s, they don't make insulin, whereas type 2s typically make a lot of insulin. It just doesn't work well. So just giving more and more insulin to somebody that's already overweight and has become resistant to insulin because of that doesn't make a lot of sense, and it doesn't usually work, at least not for very long. You have to keep giving higher and higher and higher and higher and higher doses, and then frequently you still have high blood sugar. So you've got to use treatments that make the sugar work more, or make the insulin that's in your body that your pancreas is already making work more effectively. They have several newer medicines that have, in addition to decreasing the liver production, they also will decrease the rate of stomach emptying. They slow the stomach down, so you tend to feel full a lot more quickly. And they actually, in addition, have a very potent appetite suppression effect. People just don't feel hungry. And so those are really excellent additions to the treatment. And we've seen significant weight loss, sometimes 30 or 40 pounds of weight loss treating the diabetes with drugs called Bydureon or Victoza. And when you get the weight down, a lot of times you can start throwing the other drugs away. Blood pressure gets better, cholesterol gets better, sugar gets better, et cetera.
If somebody has weight loss surgery, bariatric surgery, especially a gastric sleeve, and what they've got is a stomach and they make a little sleeve out of it, you and I were talking earlier, what does that do to people as far as losing weight and their blood sugar?
Bariatric surgery has been one of the most amazing developments in metabolic disease in my whole career. It's the only thing that I've seen that causes significant weight loss, often 75 to 100 pounds, and can keep it off. And what we find is when patients have the bariatric surgery, they may only be in the hospital 3 days. Well, they may go in the hospital on 3 or 4 different medicines for diabetes and the sugar is 250. They come out of the hospital 3 days later on no medicine and their sugar is 120. We've seen tons, let me phrase that. I have a lot of former patients that don't need me anymore.
Because they had a gastric sleeve?
Or they had some kind of bariatric
Surgery and their
Yeah.
blood sugar goes down. So blood sugar is dangerous. There are good medications. We've had a revelation of new good medications, and weight loss is the key. So we need to be exercising. That gets the sugar in the cells good.
Even if you don't lose weight, it makes more receptors for insulin, more places for that insulin to latch onto. It tunes that car engine. So even if you just get 15 or 20 minutes of walking a day, it's much better to do a little bit every day than a whole lot on Saturday and then die the next day. But a little bit every day, even if you're not losing weight, still has remarkable benefits on lowering the sugar.
Bill Law, you're a wonderful teacher. Thank you so much for coming to the Dr. Bob Show. Got to know what our blood sugar is. We got to know how to get it down. We got to exercise, lose weight, know there's medications. It's nice to have doctors like you around to help us. And I'm sad about those patients that got well and you had to lose them. Thank you for coming to the Dr. Bob Show.
My pleasure, Bob. Thank you.
Wonderful, wonderful discussion on your blood sugar. Goes too high, above 125, you've got fasting, you've got diabetes. Now, I want to talk to you about tests that you and your doctor need to have done to stay healthy. You'll want to stay tuned. Did you know that men and women are different? We'll be talking about it. I want to thank Dr. Bill Law. Wonderful discussion on elevated blood sugar. Know what your blood sugar is. Lose weight, stay healthy. If it's elevated, do what your doctor tells you to do. Now, for questions from you, the viewer, that I think will be important to your health, Dr. Bob, what tests do I need to have done on my yearly physical to stay healthy? Well, a couple of good things in that question. Number one, we all want to stay healthy. Number two, nobody really wants to go see the doctor. And yet it's very, very important that we go see the doctor so that we can stay healthy. What tests should the doctor do so that we won't have diabetes, so that we won't have heart attacks or stroke or cancer? Let's look at this. Everybody, men and women, should have certain tests. Number one, should know what your blood pressure is. 120/80 is the standard normal. So every time you see a doctor, get your blood pressure done. Blood tests. You need to know what your red blood cell count is to see if you're anemic. If you are, we need to find out why. We need to know what your white blood cell count is. It'll tell us if you have infection or if you've got an abnormal blood count. Could be lymphoma, leukemia. When you see your doctor, you're going to want to be sure that he gets your cholesterol and your blood lipids so you'll be able to keep those blood vessels healthy. When you see your doctor, you need to be sure that everybody at age 50 has a colonoscopy. A colonoscopy is not something everybody looks forward to, but it should be done starting at age 50 unless close family members have had cancer of the colon at an early age. Then you need to be talking to your doctor about getting a colonoscopy done at an early age. If things are good at age 50, just have one at age 60 and one 70. If you have problems, your doctor will tell you if you need to have a repeat in 2 to 3 years or in 5 years. So that colonoscopy is very, very important. How about the difference in men and women? Let's talk about women. Women need to have mammographies. You need to start at age 40 or 50. There's a difference in different societies, definitely at age 50. I feel like people should have their first mammography at age 40, unless there was a family history of breast cancer at an early age. Then every 2 years to age 50, and then yearly until age 75 or when your doctor says. So that's your mammography. You need to have a pelvic and a pap exam. When females become sexually active, they need to have that pap smear done at that time or start at age 21 and then follow the guidelines of your doctor. Those are two very, very important tests for women, but also thyroid disease. Thyroid disease is more common in women than it is men. So women after menopause need to get a TSH, thyroid stimulating hormone, because women frequently have cells called lymphocytes that come in and begin to take away or destroy the thyroid gland, and slowly over a period of time they get tighter and tighter and tighter. So check for your thyroid, get a bone scan, a DEXA scan. When women go through menopause, then for the next 7 years, they lose calcium out of their bones much more rapidly than any other time in their life. So know what your bone density with calcium score. Men, what do men need to be doing? Well, men need to have their PSA, prostate specific antigen. A lot of studies or a lot of information from medical information says maybe we shouldn't be doing that because it leads to too many tests. Well, it is a test that can tell you if you have the leading cancer death in men. So I'm in favor of getting the PSA. And men, they have an increased incidence of ballooning of the large blood vessel, the aorta in the abdomen. So we get an ultrasound of the abdomen that will tell you if you've got an aortic aneurysm. Men, women, different. Everybody needs blood sugar, blood pressure, cholesterol, and the routine tests. That's all the time that we have for this show. A lot of information was there. I hope you had the time to sit down and write it down. But remember, we need to be exercising. Probably the most important thing we can do for weight loss, for feeling good, for getting an exercise high, to keep our weight where it should be, and to feel good and to sleep better. Get that 8 hours of sleep. You know, it's precious, sleep is, so get your 8 hours of sleep. If you can't sleep, then you have to work it out with your physician. Is it a sleep problem or just you don't know how to go to sleep? Eat properly, eat fruits, vegetables, Mediterranean diet. You'll be healthier when you do that, and most of all, what do we want? What do we like? It's that laughter in your life. Laugh a lot, and you and I will stay healthy.